A challenging situation that I've experienced in clinical would actually be this past week. I had a case for anorexia nervosa, and she was a young adolescent. She had depression and anxiety that had been ongoing, but she wasn't presenting any suicidal ideation upon admission to the hospital and as well onto our floor. So after reading her chart and kind of going over her past medical history, medications that she's been on, and past family history, I went in and introduced myself to her, and she was very open with her case. Like, she wasn't afraid to hold back what she was thinking, what had been going on the past few days. And there was also an incident the previous night with her boyfriend that seemed very verbally abusive and as well as kind of in a threatening way. So she was very open with that, and also the doctors were doing rounding at the time as well. So she kind of expressed to us that her boyfriend, he has his own like mental health problems. He has suicidal ideation. He was pretty much threatening to say that he would kill himself, and she kind of was going to take that on if he ever did commit. So our priority became the boyfriend and our patient's situation, because he was allowed to visit. And I, in my mind, was thinking that he shouldn't be allowed to visit because this is our patient, she's our priority, and her mental health comes before anyone else's. And she also needs to focus on herself before she can focus on her boyfriend's health or even her family. She had problems with her family. Her sister had depression and anxiety, and her family moved away to Florida. So in this situation, it was challenging because with collaborating with the doctors on the floor, I was also the nurse, and as well as my instructor, we were kind of deciding where should we go from here as far as like the boyfriend situation. Should he be allowed to visit? And while I was more on the side of wanting the boyfriend not to visit only for her sake, if he ever did try to like harm her or anything, we wanted to make sure that didn't happen. But I was also kind of thinking, well, she did express that he was the reason that she was getting treatment, and that if he did commit suicide, she wouldn't feel the need to get treatment anymore, and she wouldn't feel the need to live. So I kind of took it on, like, as like a nurse, a future nurse, I really wanted to practice like therapeutic communication with her and like letting her know that I would be there for her if she ever needed to like talk to someone. So me and my instructor, we kind of were like, okay, like checking on her every now and then. She was doing really good with meals, but the challenge was that she wasn't, during lunchtime, she didn't want to eat like a whole meal, and she kind of got a little bit frustrated. But it also didn't help the fact that mental health had been in to see her, and every time that they would be there, it would be like 4 meals. So the nurse and I kind of went up above and went to the attendings, and we were like, can we just make sure that before meals that she doesn't have an interaction with the psych team, or having to deal with expressing what was going on with her case, because that seemed to heighten her anxiety even more. And she was on continuous monitoring, so every time that someone would be in there talking to her, I would notice that her heart rate would like go up to 140. So you would think that she'd be exercising, but no, she was just like expressing more anxiety because she's constantly having to repeat her story about her boyfriend and just her whole family history and what she's been going through. And then we would get to the meal times and the snack times, and she wasn't able to eat a whole meal. So then we would have to supplement her some Ensure Clear in order for her to actually like meet her calorie intake for the day. She also was never even getting in her fluid intake for the past previous days, so that was another goal of ours. So it took a lot of encouraging and a lot of therapeutic communication. But towards the end of the day, like the more time I went in there, she was looking at places to go for eating disorder clinics that would also help with mental health. And she found some places in Florida, since we were kind of telling her that you should not really be so close to your boyfriend right now. It's time for you to focus on yourself and not him. And his mom was taking care of his mental health, so he was kind of like taken care of. So he was seeking the treatment that she needed to do hers right now. And so I kind of talked to her for a while, and she was showing me all these places. She was so excited. She was like, I'm already talking to these places down in Florida. They seem so nice. She was showing me pictures of all the rooms. So I could tell like by the end of like my shift, she was actually improving as far as like being more cheerful and more excited towards her treatment, rather than before she was kind of like, oh, he needs the treatment, I don't need it, like I'm only here because of him, where we wanted her to be at, I'm here for me, not for anyone else. So I feel like that was just a challenging situation. I've never really encountered such a intense case as far as emotionally. But I feel like I did a great job as far as therapeutic communication, actually advocating for my patient, by collaborating with the healthcare team, and just being there for her. A positive outcome, and also kind of like another challenging one, was a case where I had a perforated appendicitis, and he was on 10 milliliters an hour for IV fluid since he was on an MPO diet. And so later on in the day, he was, his vital signs were trending down. His mouth was becoming more and more dry with like, no matter what we were giving him, like ice chips or whatever it was, like couldn't do anything more for him. His urine was becoming more concentrated, like darker. He was constantly having diarrhea throughout the day, which is more of like a sign of, it can be common after appendicitis, but still he was losing even more fluids after each incident of diarrhea, and he wouldn't be able to make it to the bathroom sometimes. So another time that was collaborating with the attending physician, and the physician assistant originally came up, and she pretty much didn't want to do anything about it. She was like, the 10 milliliters an hour is going to help him. We're kind of progressing to a regular diet, so we need to start him off slow, especially with how severe his case was. But my nurse and I, we just like, he needed more. He wasn't getting anything. Like, the mom was becoming more worried, but she also didn't want to progress him so fast that he would, have to be back into the OR or have a severe case again. So finally the attending physician came up and was reviewing his case. I went in the room with him, and he was kind of communicating with the mom and the patient, and he was finally able to actually give him 100 milliliters an hour for IV fluids. And that was a huge jump from where he was at, but it was something that he really needed. So the mom finally agreed to that decision. And by the end of the day, like, he was doing so much better. He hadn't had any more diarrhea, or if he did, or it was becoming more formed. And he was actually able to make it to the bathroom. His urine wasn't as concentrated. It was more of like a light yellow now rather than a dark yellow. So he was improving. His vital signs were back to being like normotensive. So he was doing a lot better, and it was such a positive outcome. I felt like through the help of my nurse and like my instructor, we were actually able to get to the point where we wanted him to be, and actually see him improving before I left for this shift was a great feeling.